So we're going to talk about the non-contractile aspects of the shoulder. We'll start off with the humerus. So we've got the humerus here. We've got a deltoid tuberosity, which is on the lateral aspect, just about the middle way for the humerus, and that's called the deltoid tuberosity. And as you can imagine, this is where your anterior, middle and posterior fibres of your deltoid attach into. So that's a deltoid tuberosity. We'll just come a little bit anteriorly there. Again, we've got the surgical neck here, and it's called the surgical neck because that's the most common place is fractured in the humerus. We've got the surgical neck, and this line here is the atomic neck, and then the ball on the top here is the head of the humerus. As you can see, there's two bony prominences here. You've got your greater tubercle and your lesser tubercle, and then the gap in between is called your bicipital groove, or over known as the interbuccular groove. To palpate this, you can get your patient to flex it 90 degrees and locate the acromion. You want to come about an inch and a half inferiorly, and what you want to get your patient to do is laterally rotate and medially rotate of the shoulder, and you should feel the two bony prominences of the greater and the lesser tuberosity and the gap in between there. Yeah, so we're just going to come around a little bit from the posterior aspect here. As you can see, we've got this triangular bone here. We've got the medial aspect of the scapula. We've got the inferior angle of the scapula, the lateral border of the scapula, and the spine of scapula. Again, to palpate this, you can get your patient to extend and medially rotate, which will bring the scapula out, and you can locate the inferior angle, make your way up, and that's the medial border, and the other side for lateral, the lateral border. Obviously, when you get to the spine of scapula, you'll use your two fingers and just go in between, just to the top there. And as you come to move anteriorly, you'll come on to something called the acromion process, which is here. And again, just a bit inferior to it, we've got this little kind of indentation fossa thing going on here. We've got the supraglenoid tubercle, and we've got the infraglenoid tubercle, and in the middle we've got the glenoid cavity. We'll come a little bit anteriorly again, and we've got the coracoid process of the scapula, and just superior to that is this S-shaped bone called the clavicle. It's a very superficial bone. You can palpate this quite easily, as you can see quite easily on patients. And just again with your two fingers coming all the way across till you reach your manubrium, and you've got your sternum here also. And just on the anterior part of the scapula, in here we've got the subscapularis fossa, and as you can imagine, this is where the subscapularis muscle originates. But also within this area, we've got three joints. We've got the sternoclavicular joint, which is a synovial gliding joint, or is it over known as a plane joint. And again, if we're coming across the clavicle, we've got the clavicle and the acromion which articulates, and this is called the acromioclavicular joint, which again is a gliding joint. And obviously we've got here, which is the shoulder joint, over known as the glenohumeral joint, which is a synovial joint also. And as you can see, it's not really attached between bone to bone, and it's the stability of this is through four muscles. We've got the supraspinatus muscle that comes in here. We've got the teres minor, the subscapularis, and the infraspinatus, and that provides all stability and gives the rotator cuff of the shoulder, and that's the non-contractile aspects of the shoulder.